We got to wake up, America. This is preventable. All the work that we're doing here and all the care that we're doing, the vast majority of it is preventable.
This surge seems a little more mentally draining than the previous ones. In the past, we didn't have the vaccine, so it was us all hands together, all the support, but that support has kind of dwindled from the community, and people seem to be moving on without us and kind of forget that COVID is still very prevalent, especially in New Hampshire right now.
We started to see the next wave of almost entirely unvaccinated patients, people in their 40s, people in their 30s, otherwise pretty healthy, getting really, really sick. And at least in our ICU, all of them are unvaccinated.
The impact of the surge is that we can't do what we normally do. We've restricted and almost eliminated entirely elective procedures because we don't have the beds. The beds are full in critical care and other areas of patients with COVID. You know, the typical surgical admission could take maybe 3 days in the hospital. A very typical COVID admission could be 3 weeks.
This surge that we're experiencing now is the largest volume of patients that have been the sickest, and it's been going on the longest of all the waves that we've had. So in many ways, this has been the worst at a time where we really thought we weren't going to have to deal with this again.
I ended up getting COVID. I've been in ICU since the 26th of December. I was seriously ill. I heard that it could have been a touch and go. I could have ended up probably passing away if these people didn't put in 100% effort each and every day.
None of the people we've taken care of who got really sick from COVID thought they were going to get really sick from COVID. So when everybody says, well, I'm too healthy to get really sick, that's what every other person thought too. The magnitude of COVID cases that we're seeing is starting to really affect our ability to provide services to people who don't have COVID.
We're also not able to take the number of transfers from around the region. We serve a huge swath of this region. Eastern, northeastern Vermont, from the Canadian border down to the Massachusetts border, relies on us for high-level care and critical care, and we've not been able to transfer those patients that need that kind of care.
A lot of people in the world today are not taking this serious. I will do anything I can to be the voice of people that don't understand you've got to get vaccinated. You've got to get it done to protect each other.
If people got vaccinated, not just for themselves, but for younger children that can't get vaccinated and immunocompromised people that may not be able to, this is really important. This is now at a point where it is a surge and a crisis that we can prevent for the vast majority of people.